Hello and welcome to Code TV. So in this channel we are particularly going to be talking about medical coding. So in that, what exactly is medical coding? Medical coding is conversion of codes or conversion of diagnosis into medical codes through which you can get the billing, okay? Through which you can get what? Insurance, okay? The most appropriate definition I can give you later, but just for understanding you can understand through this. Now next, what is actually included in this? So for practicing this you have to clear one exam, that is CPC exam. So in CPC exam you can actually practice this without even clearing CPC, but preferred candidates are the ones that clear CPC exam. So in CPC exam there are three types of books that you have to study. They are CPT book, ICT book and HCPCS book. Now what is CPT book? CPT book comprise of the main definition of CPT is current procedural terminology, okay? So the full form is that, and it is used for coding, surgery and other procedure. The revision date of it is like every year on January 1st it gets revision every year, and the publisher of it is American Medical Association. So the next book is the one that you are seeing right now is CPT book, then the second book is ICD book, and the third book is HCPCS book. ICD book is good for interview purpose. The questions are also from ICD and HCPCS as well, but ICD, most of the interview questions that you will get after clearing the CPC, that will be from ICD. From exam point of view all three are important, but CPT is the most important as most of the marks coverage will be from CPT. Then second most important is ICD book. Why? Because most of the coding that you will do while practicing and also during the interview, most of the questions will be from ICD book. Then the third book is HCPCS. Most of the people usually ignore this book because only 4 marks questions are there from it. ICD also compromise, actually ICD also has very less few marks, but it is very important because in future you use it a lot. In HCPS it is, you should know the basics of it, but if you are like ignoring it, that is also fine, but you should know it, okay? The books that you should definitely have are CPT and ICD. HCPCS, if you have PDF, that is also fine, okay? Now what is ICD book? ICD means International Classification of Disease. What we study in this for CPC exam is 10th edition clinical modification, that is ICD-10 CM. I'm sorry about the noise, that is of machine, okay? So please ignore that, and it is published by WHO, okay? Every year new edition is there on October 1st, okay. So now the one that is on the screen, that is CPT book, okay? So in CPT book what it has is modifiers, all right? Then there are certain symbols, then the chapters, okay? I'll tell you about the chapters in this. So the first is introduction, then there is EM chapter, then anesthesia. EM is for evaluation management and anesthesia, then surgery, then radiology, pathology, medicine, okay? So these are the ones. Category 2 codes we don't use, okay? Then most important chapter of all this is surgery, because most of the questions are from surgery chapter only. So that is the most important chapter. While when you shift to coding after clearing exam, or if you are not giving exam, you're directly just learning a specific chapter or guidelines and you're specifically moving to one of it. So in that, while studying for CPC you have to study all of these chapters, but when you shift to a company organization, you will be working only in one type of coding. It can be any, like suppose you are into anesthesia coding, so you'll be particularly working in that sort. Then if you are in EM, you will be particularly working in EM department, and like that. So surgery is also there. Okay, if you are working in surgery, you'll be working in surgery only. Then there are RO coders, so different type of specialty, different type of coders are there. Okay, yes, but for exam you have to study all of it. Okay, so here this is it. Then in ICD book, there are 22 chapters, each have specific guidelines, and according to those guidelines you have to give the code of that disease. Then there is